Well, Associate Professor Michael Penniment AM joins me now, a radiation oncologist. And Michael, you work at a number of places, but it includes the Alan Walker Cancer Centre in Darwin and also the Icon Cancer Centre in Adelaide. Do some Aboriginal patients of yours struggle to get access to radiation therapy?
Yeah, absolutely, Julie. I think that radiation oncology by definition involves big, expensive machines, and a lot of care has to be focused in major centres. And so anybody that lives outside of a capital city, whether they be Indigenous patients or non-Indigenous patients, struggle to get radiation oncology sometimes.
And so if you had to name the 2 or 3 key barriers for your rural and remote patients that make it hard for them to get access to the radiation therapy that could benefit them, what are the 2 or 3 key barriers?
Yeah, I think it's the capital expense and the number of incredibly well-trained personnel to make a radiation oncology centre. And then it's also the understanding of what is involved in radiation therapy. And if you're living remote, if you're living outside of a capital city, just understanding what radiation involves.
And how does that limit access, that lack of understanding?
Well, I think that it means that a lot of the caregivers, both GPs and nursing staff, perhaps don't understand what radiation oncology is. And so then when a patient has a cancer diagnosis, they haven't got the caregivers in their community to explain what are the options for treatment. So getting the message out to the communities is one thing, and then getting those patients into the centre where the radiation oncology is sometimes difficult. In terms of getting that understanding and that education, having Indigenous health workers, Barb in our centre in Darwin's brilliant, and having a team around her that can, if you like, translate the final message of what it is that the patient's going to receive into language and into culture that's an understanding in the community. And it's also the follow-up, it's the messages, the oral message from patients that have had treatment, going back to community and explaining what they had done.
Wherever we live, we deserve the best possible chance to survive cancer and get the treatment that we need.
Aboriginal people should be able to access radiation therapy if they need it.
Right now, there are Aboriginal and Torres Strait Islander cancer patients who are struggling to get the radiation therapy that they need.
In some parts of the world, it's impossible for most cancer patients to get radiation therapy. The Targeting Cancer campaign is supporting the work to close the care gap in radiation therapy at home and abroad.
To learn more and find out how you can help, please visit the Targeting Cancer website.
Hey you mob, if you want to help, go to the Targeting Cancer website.